Thank you, Brian, for the kind introduction. Today, I'm going to talk about MyWapps and how it can be used to connect the dots in personalizing prophylactic therapy. So the objectives of my presentation is for you to have an understanding of what MyWapps is, the benefits of using MyWapps, and how to get started with MyWapps. But before I get into everything about MyWapps, I just wanted to start off by giving a few introductory slides on why MyWapps is important with regards to your prophylaxis. So we wouldn't need MyWapps if patients wasn't on prophylactic therapy. And today we're actually doing individualized prophylactic therapy and tailored prophylactic therapy. So I just want to begin with a few slides with introducing prophylaxis. This was a study that was done in 2017. The focus of this study was actually to define a range of target factor levels to be used in different clinical situations, but it actually gave some really great background on prophylaxis. It actually says that prophylactic replacement with factor concentrate is the optimal treatment for people with severe hemophilia to avoid or minimize bleeding. This ultimately prevents or reduces joint disease and improves life expectancy and quality of life towards values matching those in the normal population. Uncertainty still exists around optimal regimes to be prescribed for prophylaxis. In this slide, I just wanted to briefly mention that the World Federation of Hemophilia also recognizes prophylaxis and individualizing prophylaxis. This was actually presented as an oral presentation during the World Federation of Hemophilia Global Virtual Summit just a few weeks ago on June 15, 2020. So I just wanted to highlight here that the World Federation of Hemophilia is also recognizing that prophylaxis should be individualized, and having tools like MyWapps can help patients individualize their prophylactic therapy. This figure illustrates that someone who is sedentary may need factor levels between 1 to 3%, while others who engage in more intense activity may need higher levels. This was published by a group of experts, including some Canadian treaters. So this is further into my presentation. You'll be able to get a better understanding of how MyWapps can help with regards to ensuring that the physical activity that you take place, that you are safe with regards to where your factor level is at any given time. So personalized prophylaxis, I really like this paper. It actually described personalizing prophylaxis by using 3 pillars. It started off by using the pillar inherited bleeding phenotype, and it's recognizing that patients are different. It also talks about physical activity and recognizing that patients vary according to how active they are. And it also talks about pharmacokinetics and how it matches a regime to a patient to ensure that all patients achieve a predetermined factor trough level that's personalized to you. And it does that by not forcing patients to experience bleeds to declare the prophylaxis, by not needing any type of washout to do this type of pharmacokinetics, which we're further going to explain in the presentation. So there are many publications that have been reviewed with regards to the clinical implications of personalized prophylaxis. In summary, they mentioned that not every patient is unique, and a one-size-fits-all treatment approach is insufficient. Since bleeding episodes occurs in different circumstances, prophylaxis should be targeted using the full PK curve, and that a PK-guided prophylaxis using interactive digital technology can support interactive prophylaxis, and that there's been real-world evidence published on personalizing prophylaxis. So the benefits of prophylaxis, there's been many publications talking about the benefits of personalizing and tailoring prophylaxis. In the publications that I've cited on this presentation, they talk about that it can actually have a 10% reduction in costs, which is, we're all very mindful of the costs that our healthcare, the medications that we take and being very mindful that we don't waste it in any way. There's reductions in bleeds per year, which that's a great benefit. There's also a tendency towards improvement of annualized bleeding rate and a decrease in annualized joint bleeding rates. So when I think about the years of hemophilia experience that I have, when I think about prophylaxis and personalizing prophylaxis, I also think about, bleed prevention, bleed control, avoiding patients' joint damage, and their quality of life. So it is important for patients to discuss how active they are with their HTCs. Communication and collaboration with your hemophilia clinic is essential to optimize care. Your hemophilia treatment center can help you ensure your physical activity is done safely. Having a conversation about physical activity while reviewing patients' diaries, your MyCBDR, which many of you are probably using MyCBDR, along with a pharmacokinetic profile, that's the WAPS email, which is your MyWapps is a companion app for MyWapps email. And I'm going to, not to confuse you, but I will for sure make sure that you know exactly what I'm talking about when it comes to WAPS email and MyWapps further into this presentation. So this is the basic principles of pharmacokinetics in hemophilia, and the full PK curve should be considered to optimize your physical activity and to prevent your bleeds. So you have an infusion, and after you have an infusion, you get what's called a peak factor level. And this peak factor level can be important in some patients when hemostasis is significantly challenged, such as during trauma or physical activity or during a surgical procedure. And then you have what's called the area underneath the curve. That this area is associated with increased protection against joint and non-joint damage. And you've also heard your clinicians talk about your half-life. Many of you have probably heard us talk about, your half-life can be a range anywhere between 8 to 12 hours. So using, programs like WAPS Emo and being able to use apps like MyWapps can help you know what your half-life is. And, that can be helpful in many situations. If a patient has a short half-life of 6 hours and he has a surgical procedure, then most likely your physician is not going to give you an infusion in 12 hours, he'll most likely give you one in 6 hours. So this is really great to know that if there's such a wide range of half-lives, that is really important that if mine is 6 hours and the next patient is 12 hours, that our treatment plan is done very differently. And then you've heard us talk about your trough level, and that's the level that you're at before you get your next infusion. And this level is important to prevent spontaneous breakthrough bleeding. So there are a few methods that you can use to obtain your PK samples. The two methods mentioned on this slide are one is called the individual PK study method, which has been known as a classic method. And the other approach is the population-based PK study, which is what WAPS Emo uses. And the data that comes from WAPS Emo that goes into your MyWapps is this is the method that is used for those programs and for those apps. So with the individualized PK studies, it's a little bit more challenging in that you need several time points. It can be up to 10 or 11 time points over a few days. This type of an approach is often used during clinical studies. It requires a washout prior to sampling, and you may need to do different time sampling depending on if you're on a standard half-life product or if you're on an extended half-life product. It also may want you to do like a fixed dose. And it also indicates that it's probably best done with children greater than or equal to 10 years of age, just because the amount of pokes that you will need to do this type of method. Now, with the population PK method, it requires just a few samples, which I'm going to give you some examples in a little bit later in my presentation. You can actually, it doesn't require any type of washout, and you can do it mostly, you can also do it on your usual prophylactic dose. So if you're coming into clinic and you're due for your prophylaxis, it doesn't have to be any type of fixed dose. And the preference is to do it when you are not having a bleed. So that's just a very brief overview on the two types of approaches. But what I wanted to highlight is that the WAPS Hemo program uses the population-based PK study approach. So this is an example of what we do here at McMaster Hospital, or the guideline that we like to follow. Of course, every patient has very individual needs, so it's a guideline. It's not it's optimal sampling times. It doesn't mean that this is the times that we're able to get at all times, but this rectangular bar, that represents the amount of hours that patients would spend in the clinic. So on an average, it could be, for our severe patients, could be anywhere between 2 to 3 hours that you would be with us during your clinical visit. So we can take that opportunity to get your PK sampling done. So then we would draw your pre-dose. A lot of the times what I will do with our patients is, before their clinical review, I will call them, and because sometimes they're due for their prophylaxis on the day after clinic visit, and I will just say, hold off and do your treatment in clinic with us so that we can do some of your PK profiling. So we'll do the pre-dose, and then they'll get their infusion after we do the pre-dose sampling, and then we'll then do a post-dose sample, anywhere between 1 to 3 hours. If the patient is going to be with us for up to 3 hours, we like to do it right at the end of their visit. And then if the patients can as well, the preference would be for them to come back within 24 to 72 hours. Now, if they could not come back in the 24 to 72 hours, we can actually use the previous infusion data information and use our pre-dose as 2 time points. So we would just need to ask you, the date and time that you got your previous dose, and then we could use that initial time sampling that we did before we gave you your factor as 2 time points. So I know I still haven't gotten into the MyWapps, but it's really, really important that I connect the dots with how MyWapps, MyCBDR, WAPS Hemo, they're all connected. And I'm really hoping that I make this clear for you tonight, because these tools have certainly helped me in my practice, and when I'm engaging with the patients and during their clinical appointments, and also when I'm having the phone conversations with our patients. Having these clinical tools I've found very helpful to my practice. So just a little bit of a background, CBDR is a Canadian Bleeding Disorders Registry, and because the treatments are done mostly at home, it's really important for us to have registries and to have programs where we can actually consolidate information into one easy place for us to see the patient's medical information. And also I wanted to mention here on this slide that the patients have what's called the MyCBDR, and that's where you enter in your bleed infusions. And when we open up CBDR on our clinical side, we have a little tab on the right-hand corner that brings up MyCBDR. So anytime, or as best that I can, of course, sometimes we take our phone calls outside of our office, and we might not be right next to a computer. But if I can at all costs, I will open up CBDR when I'm having phone conversations with my patients, and also then will review their MyCBDR with them during that phone conversation. So just to give you a tiny little bit of background, that it was launched in 2015, and as CBDR was launched, and it's a Canadian Bleeding Disorders Registry, and it's supported to help facilitate the patient's care. And it has the MyCBDR is the patient's app that helps patients to enter in their infusions and keep record. And what's nice is that as long as the patients are updating their infusions in MyCBDR, it comes directly to the healthcare professionals database, the CBDR. So what is the connection with CBDR and MyCBDR? So I'll give you a little bit of a background here. CBDR is designed to be used on a daily basis by clinicians in all hemophilia treatment centers to assist in managing the treatment of people with bleeding disorders and to gain a better understanding of the incidence and prevalence of bleeding disorders. This information will also be used to understand demand for and to facilitate ordering of clotting factor concentrate. MyCBDR is the system used by the patients and or their caregivers who are on the Home Infusion program. It is linked directly to CBDR, which I've already mentioned, at your hemophilia treatment center. MyCBDR is internet-based, and it offers a computer application on a mobile app. It can be on Android, it can be on iPhone. So what does MyCBDR app to offer to you? It's a fast, easy, and secure way to record your bleeds and your home infusions. It shares information with your healthcare team. It manages your home inventory of factor concentrates, and it keeps an easy to see record of your home health care. So this slide is just giving a demonstration that CBDR is the Hemophilia Treatment Center, Canadian Bleeding Disorders Registry, and then we have the MyCBDR, which is the patients, and you can see there that there's a phone also that just shows how it can be downloaded on a phone or it can be downloaded on your computer. And these tools continue to be further integrated, and further integration allows the hemophilia treatment centers to individualize your care and be more efficient and optimizing your care as well. The other nice thing about this is that if you move to another center, we can actually transfer your information that was put into one center over to another. So if someone moved from the McMaster Center and went to the London Center, we just need to transfer that information over, and then everything will be seen on their side. And this slide just further shows you the integration of them all together. So if I was to open up CBDR right now, there is an interaction there that I can pull up. Well, when I open it up, sorry, on the right-hand side, I'll see MyCBDR, and then I can go into an interaction, which is your pharmacokinetic interaction. And if all of your pharmacokinetic information was put into the CBDR interaction, we can then go into the WAPS program and pull up your profile all at once. So they're all connected together. So it's the CBDR, MyCBDR is connected. CBDR is also connected to the WAPS email, and then you have your MyWapps connected. That's a companion app for the WAPS email program. So WAPS email and MyWapps connection. So let's talk about WAPS and MyWapps. So now we're going to get into and discuss further in details the objectives of this presentation today. So what exactly is the WAPS email program? It's a web accessible population pharmacokinetics service. It's freely available to all participating hemophilia treatment centers for adults and pediatric patients. It requires only 2 to 3 sampling points, which I just previously mentioned. It provides a PK estimate for all standard half-life products and extended half-life products. All the reports are manually validated by a PK expert, and it simulates regimes best suited to activity and lifestyle. So what is MyWapps? So the MyWapps enables you to view real-time estimates of your factor levels at any time, online or offline, based on your individual pharmacokinetic study. And like I mentioned as well, it's a companion app for WAPS emo that can be downloaded on your phone or your computer. So with your MyWapps, you can view your factor levels, including estimated future levels. You can record and track your infusions, and you can also receive reminders when it is time for an infusion, and you can receive notifications when factor levels drop to a medium or a low zone. And the connection here, and I don't think I just mentioned, and I apologize for that, is that once you have both apps on your phone, you will only need to record your infusions on the one app. So you'll still do all of the recording of your infusions on your MyCBDR, which is very important to do that. And then once you record it, it will automatically sync to your MyWapps app. And I have some visuals to show you in the next few slides. So this slide shows the vision of WAPS emo and is found on the home page. Pharmacokinetics is important and empowers tailoring treatment needs for individualized dosing. PK is just one component, so it's not just about the PK, and we have tools like MyWapps to help with that, but we also need to look at things like your bleeding history and your lifestyle, and if you have an inhibitor, and along with your PK together, this can empower hemophilia treatment by facilitating individual dosing. So now we have all these tools. So we have our MyWapps and we have our MyCBDR. So we have all those tools. So let's chat more about how having all these tools can really help you to personalize your own individual hemophilia care. So WAPS emo. So WAPS emo, your center will, in order for you to get MyWapps, your center has to join the WAPS emo program. And then if your center is part of the WAPS emo program, then they'll request and receive a PK. So if you already have a PK, then they can get started on individualizing your prophylactic therapy. If you don't, then your center will request you to get some time points done to get a PK done. And then after they've requested a PK, then within WAPS, we have a clinical calculator. And within this clinical calculator, we can prepare a PK tailored treatment dose that best suits your needs. And then after that, you can get started with using MyWapps. But I'm going to further explain this with more visuals as well. So I want to take you back just a tiny little bit. WAPS emo outputs. So the clinical calculator that I just mentioned, the clinical calculator is very important part of the WAPS emo program because it's the calculator that you and your doctor will use to best get the best treatment regime that's best for you. So by using this calculator, you and your doctor can decide on what treatment plan is best for you. And I'm going to just quickly show you how that works right now. So in the clinical calculator, you'll see that, the age of the patient, is body weight, we have the height of the patient. Then we would put in the dose. So if your doctor prescribed 2,000 units and it was a prescription of every 2-day infusion, you would just check the little button down there, calculate. And once you would check calculate, you would get this calculator output graph. It will tell you what your peak level was. It will tell you what your trough level is before your next infusion, and will also give you all of the levels that's in between your peak and your trough. And you can have this discussion with your physician to see what treatment plan is best for you. And these are just some examples of treatment plans that you and your physician could chat about. So let's just take for an example that your current treatment dose is 2,000 units every 2 days. You get a trough level of 11%, and then you get a peak of 115%. And I'm sorry, I'm going from the bottom up. And then you think, okay, with the activity that I do, maybe I can do less infusions, or maybe I don't need as high of a trough level as of 11%. So then your doctor can say, well, if you want less infusions, let's see, by keeping you on the same dose, let's see what happens if you treat Monday, Wednesday, Friday. So then on the Monday, Wednesday, you will have trough levels of 10 and 11%, and the 4%, sorry about that. So then you can further explore and say, well, I don't mind doing every 2 days. I have great veins, and I wouldn't mind staying on the treatment plan, but let's just see what happens if we lower the dose. And by lowering the dose, you can still get a good trough of 6%. So that might be something that you might want to consider changing. And again, the other is another example of changing the dose and then changing the frequency. So this is what the WAPS emo clinical calculator does. And after, what I want to demonstrate here is that this is how you get started with MyWapps. So right here, once we decide on the treatment plan that best suits you, and if the decision was to do 2,000 units every 2 days, then you click on Enable App, and as soon as we click on that Enable App, we get this pop-up. And this is a pop-up, and this is still at this point done at the clinic level. So this is something that, you know, your doctor or somebody else in your hemophilia treatment, maybe it might be your nurse, will do this for you. And you will need to give your healthcare professional your email address. And then you'll see that there's two different ways to sign up. There's what MyWapps, and then there's what MyWapps infusions via MyCBDR. So WAPS email is a global program. So these MyWapps and WAPS email is used globally. But here in Canada, we have this MyCBDR, which is fantastic. That MyCBDR and MyWapps, they all integrate and work together. So we will choose MyWapps via MyCBDR, because once you enter your infusions in MyCBDR, it automatically syncs to the MyWapps. So that was all done on the patient, on the clinic side. So now this is what the patient has to do. So you call your clinic and you tell them that you're interested in getting the MyWapps app. They will activate by sending you an email. Once we click that button, you know how on this, sorry, I'm just going to go back for 1 second. Right here, after we say activate, then you actually get an email. You will get this activation email, and the patient will have to click and register the link, and you'll have to create a password. And then you go to the App Store and you can download the MyWapps app, and then you can get started on logging in and recording your infusions and start using the MyWapps. So this is just a visual that you will get an email, and then this is the email that you receive. So this is exactly what the email looks like. And within that email, it does have a link, and you click on that link. And once you click on that link, it will actually tell you to register for MyWapps registration. So this is how you would get into registering for MyWapps. You will have to create a password, and then you will need to confirm your password. You'll have to check that you've agreed to the terms and conditions, and then you'll save. And once you've done that, you can go to the App Store, download the app. So when you download the app and you sign in, it will say link to your hemophilia app, or it will say try the demo. So you're going to link to the hemophilia app, and when you click on that link over here, you'll see that it comes up saying link to my hemophilia app or link to MyCBDR, and it's really important for you to click on your MyCBDR link, and then that actually syncs your MyCBDR app with your MyWapps app. So now let's get into introducing MyWapps. So this is my phone actually, and I downloaded the the MyWapps demo. So if you don't have MyWapps, you're more than welcome to go into the App Store and download the demo and to take a look at the MyWapps. And if that was something that you were interested in getting, then you would call your clinic and have a chat with your clinic too, so that they can help you get MyWapps. So you also once you download the app, you'll see that you have many functions. This is the home page. They list them as levels, your treatment plan, a calendar, an estimator, and some settings. And we'll go into them a little bit more in the next few slides. And if you have a smartphone, you can actually use the MyWapps on your smartphone. The MyWapps is financially supported by an unrestricted grant from Bayer. So here you have where you can view your current and future factor levels and your next scheduled infusion. And this is one visual. You can actually change how your levels look by, you can have it on a graph, or you can have it in a pie. There's 3 options on how you may want to have this visual to look for you. And then, so here you record your infusion. So once you record your infusion, you'll see that your level is now gone up. And within that, there's a little X here. That little X is actually not highlighted, but when you do click on it, that's when you will see these 2 buttons. That one says record infusion, and the other one says edit the last infusion. So for some reason, if you made a mistake, you can go in and edit the last infusion. And here's your treatment plan. So this was a treatment plan that was came out from the WAPS EMO clinical calculator. And this is a treatment plan that was activated by your hemophilia treatment center. But I want to just point out here is that if for some reason, your treatment plan change, any infusion that you put into my CBDR updates your MyWapps. So even if your treatment plan is every 2 days, but you treat it daily for some reason, or your treatment plan had to change because of vacation or something, that all of your estimates and all of your levels that goes to MyWapps automatically gets updated as you enter infusions into my CBDR. And then you have the calendar view. I really like this calendar view. And within this calendar view, there's you can export some infusion logs, and you can actually send it to your email, and you can view your infusion history and any scheduled infusions. And what I like about this calendar as well is that it actually will make a little note and will give you a little pop-up that you've missed an infusion. So this just goes on to with more features that's within the MyWapps app. And you also have what's called an estimator. And this estimator is that so right now, this is showing that this person as a 1%, but if I was to give myself my injection right now, my levels would go up. And then what this estimator does, you can just drag the estimator along, and the date and the time will change as you drag it along. And if you had planned to do golfing with your friends tomorrow night, and you wanted to make some plans on whether you think you might need factor for that golfing event, then you can just drag over and see where your factor level is going to be tomorrow night at 7 o'clock when you go golfing. And then the MyWapps app also has a settings. And in this settings, you can actually color code the settings. Now, I like using the green and the yellow and the red. And what these said, it actually color codes your levels. So if your level is greater than 15%, it's color code. You can color code it in. I have color coded it here in green. If your factor levels are between 3% and 15%, you can color code it in yellow. And then if it's below the 3%, it's kind of like, okay, stop, wait a minute. If you're doing anything risky, you might want to reconsider because you don't have a lot of protection at that time. It also can give you some notifications. It can notify you if there's any of your next infusions. So it's a very intuitive app, and I really have gotten a lot of great feedback from patients. And in the next few slides, and I'm going to share with you a couple testimonials that I got from some patients after they've been using the MyWapps app. So this is a gentleman, and he describes using MyWapps by saying, I am a 58-year-old factor 9 severe hemophiliac. From my childhood in the 1960s, I can say that the only remaining bleed treatment still practiced are ice, rest, and painkillers. Technologies and ideas that spur them on continue to advance, and hemophilia care in particular has been exceptional. Medical options not affiliated with molecules or hamster ovaries are having impactful effects on my life today. Case in point is the creation of MyWapps, a medical device with the ability to report current and accurate factor levels. Remarkably, it is available 24/7 on my laptop, on my phone, on my tablet, and even on my watch if I choose. Knowing that proper factor level is critical to ensure adequate dosing for hemophiliac patients. Recently, I just need to click on this. Recently, I had cause to track my PK levels as reported in MyWapps and compare them to how I was actually feeling. Having just changed concentrates, I felt I was beginning to show symptoms of bleeds on or before my scheduled infusion date. This was a new phenomenon and should not have been the case. So over the course of several months, I routinely recorded my PK levels when these symptoms presented. What was apparent was that I was on the verge of having a bleed. Ambient, I was still at a much higher trough level than one would expect. It was nevertheless consistent, and the PK information revealed that this concentrate works differently, suggesting that further investigation into how this product works is warranted. The ability to use the PK from MyWapps resulted in a revised dosing schedule designed to minimize the frequency of infusions while guaranteeing a safe minimal level of factor. It was quick, it was easy, it was accurate, and it aided in maximizing my care. My heartfelt thanks to the creator of this device and the people who have contributed to its development. Another testimonial from another patient said, I found MyWapps very useful when I underwent an ankle replacement recently. Coming out of surgery, I was at home after 3 days and taking infusions every 12 hours. I was also heavily medicated. It was extremely useful to have a tool that told me my factor level in real time, in case I had to go a little past the recommended treatment times. I knew I wouldn't be putting myself at risk. It was also good to have an easy way to create an accurate record of the times that it took my infusions. During the early days of my recovery, even with a spouse to support me, it was hard to manage taking the necessary pain medication and infusions at the right time. So those are very nice testimonials that patients have given me. And I'm now going to share with you a case study. So this is a case study using MyWapps during a minor procedure. So this is a severe hemophilia A patient. The prescribed treatment plan was every 2 days. That was tailored using the WAPS EMO program. And this gentleman also has MyWapps. He ended up getting a knee bleed that required an aspiration. Now, unfortunately, he wasn't doing his infusions every 2 days, and 5 days, he went out 5 days before he gave his infusion, and on that 5th day, he ended up getting a knee bleed. And during that time, he told me that his MyWapps did show that he was at less than 1%. And when he got his bleed, he started treating every 12 hours on the day of his bleed. He notified the Hemophilia Treatment Center 24 hours later, and at that time, he told us that his factor level was 91% on his MyWapps. We consulted, or I consulted, sorry, our hematologist and our orthosurgeon. The patient was seen by the orthosurgeon within 2 hours, and he had a knee aspirated with immediate relief. Post this procedure, the patient called me and told me that his factor level was now at 66%. I consulted back to hematologist, and the patient was told to give another infusion, and his level after he gave his infusion, he told me it was now up to 149%, and then in 6 days later, his knee was back to normal. So MyWapps gave the patient and the healthcare team the ability to monitor individual factor VIII levels without delays. And during a minor procedure, MyWapps gave the patient the reassurance that his factor levels was sufficient for that procedure. So in conclusion, connecting the dots between MyWapps, WAPS Hemo, CBDR, and MyCBDR. When used clinically, these applications are essential to providing optimal care and allows the healthcare professionals and the patient to have an informative and interactive discussion. Knowing and reciting history by memory is not ideal. These tools allow us to create a more accurate picture to individualize hemophilia care. This, in combination with the projections created on the WAPS EMO, empowers the patient to be an active participant in their care and to make informed decisions about treatment before daily physical activity, while allowing the healthcare teams to further individualize care using the patient's unique prophylactic pharmacokinetic profile. In conclusion, MyWapps is helping to make advancements in hemophilia care today. So why is PK important? Because we are all different.
Thank you so much for the presentation, Kay. That was great.
You're welcome. Thank you.
All right, let's move into the questions period. Just a reminder to the audience that you can submit questions through the questions tab that you have there, but we've already gotten a couple of questions that we can start with here. All right, first question. Is it necessary to download WAPS Hemo for MyWapps to work?
So you can hear me, right? Yeah,
Yep.
yeah. So the WAPS email is all done on the clinical side. So that's if that is something that is done at your HTC. So what the patients does is they download the MyWapps app after it's been activated by your clinic. So the WAPS email is what your clinic has to set up, and then they create your PK profile within the WAPS email program. And yeah, so no, that's not something that the patients does on their side. That happens on the clinic side.
Gotcha. Okay. Now a follow-up. If I've completed a WAPS PK study, will I be able to start using MyWapps immediately?
So that's, yes, you can start using immediately, but you have to connect with your hemophilia treatment center because they have to activate it for you. So, and it's really important to get this message out because I think that's the patients, it is a little bit confusing there. So no, so you can't just go ahead and get MyWapps independently on your own. You have to do that in collaboration with your hemophilia treatment center. So you have to call your doctorate or your hemophilia treatment center team.
Okay, yeah, so it's important that they get a call out
Yeah,
there so that they know you want to do it.
right. You can actually, you can try out the demo. The most that you can do on your own is to try out the demo, but then to get to use it, to use your own individualized PK profiling, you have to connect with your clinic.
Yeah, I think the demo is totally brilliant because it gives you a chance to try it out, see if you can integrate it into your day-to-day life that way.
Right. And I don't know if there's any healthcare professionals on the call, but I would actually encourage, I certainly find it really helpful having it on my phone. And when I'm in clinic, I sometimes will show it to the patients. And it's helped me because it's not an app that I get for me. This is an app that the patients get. So to keep myself knowledgeable and what the patients are seeing, having the demo and being able to look at the demo was really helpful for me.
Yeah, no, it seems like an amazing way to do it, especially the phone, I think is a very cool way to know what your levels are going around. Like it adds a huge layer of functionality to it, I think. Another question we've got here is what happens if infusions are done less frequently than what is in the treatment plan?
Then it will, your MyWapps will still give you to predicted levels. It doesn't affect it at all actually. So even if you go if your treatment plan is every 2 days and you end up doing it every 3 days, then it doesn't change your PK profiling at all. You still get the accurate current levels. Yeah, it makes no difference. The only thing is that, it's important that if you have the MyWapps app and your current treatment plan was built on a treatment plan, let's just for an example, say every 2 days, but you went into your hemophilia treatment center and your plan now got changed every 3 days, it's important for your hemophilia treatment center to make sure that they changes your treatment plan and gives you a new one that kind of matches and changes it on your MyWapps.
And it keeps you
But
accountable.
Yeah, but it's to keep it accurate. That's right.
Perfect. We've also got here, does MyWapps work with, is it basically up to date with new extended half-life products coming out?
Yes. The answer to that is yes, but I would further encourage you, to talk with your physician about that. But yes.
Gotcha. Got a new one coming in here. Excellent presentation, Kay. Thank you, is what they're saying. From your experience, is there an age group that is more likely to use MyWapps on a regular basis?
Well, that's a really, really good question. MyWapps can be used on any age group, but I also take care about the pediatric and adult patients. But when you're young, getting the time points might be, you might want to wait a little bit and until you're able to get the proper PK sampling time points. But because you only need a couple time points, and the way the WAPS Hemo program works as well is that you can actually merge time points. So if you took a couple time points, you can come back in a few months and get another time point done to build a PK profile. So for sure it can be done at any age. I think the biggest challenge will be the sampling, which only requires 2 to 3 samples. So for sure, talk to your clinic. It's possible to have it at any age.
Awesome. And another question here. Do you have to enter infusions twice, once into like MyCBDR and once into MyWapps?
No, and thank you very much for that question, because I really wanted to make sure that that was clear. Because during my presentation, I tried to make that clear, but then the video that we showed at the end, it did show the parent actually putting it in through the MyWapps app, and that's only if you live outside of Canada. So if your treatment center has CBDR and MyCBDR, and you're using the MyCBDR app, then you only enter your infusions in the MyCBDR app, and then it automatically syncs to MyWapps. So pretty much once you get the app downloaded on your phone, other than for looking at it to view it, you don't really need to input anything. It's more or less for viewing purposes. You really only input into your MyCBDR, unless you wanted to use some of the great features that's now on the MyWapps program with regards to exporting some of your history and looking at those things. But for sure, the answer is please just enter your infusions through MyCBDR.
Great. Now, would MyCBDR send you a notification when you're, say, low on, when you're nearing your trough, or low on, or your levels are getting low?
So will MyCBDR send you a notification?
Oh, sorry, MyWapps.
Yes, you do get a notification.
Perfect. Now, another question here is, so right now, MyWapps is for people with hemophilia. Will MyWapps become available for von Willebrand's patients at some points in the future? And can it be made to work with, I think the real question is, can it be made to work with things like Humate-P and other von Willebrand's products?
So yes, it's currently, my understanding, and please go back to your hemophilia treatment center and get it further clarified. But with regards to products like Humate-P and Willate, because some of these products are actually used for hemophilia patients, the MyWapps already works for those products. So yes, so technically yes, you could get it.
Wonderful. No, that's great. I didn't know that. So there's a question I have, actually. So how will the clinic nurses be working with patients to tailor to their needs? And so obviously a big part of the functionality of something like this is to help with people like manage their physical activity to be as safe as possible. But how will that work practically between clinics and patients?
So how I see that working practically, and I'll go, I can use my experience, is that, when patients come to clinic, we really make a really good effort to put up the programs like CBDR, because within CBDR, we have all the MyCBDR information, so all of the patient's information. And what we do, so that we can make sure that the patients leave with their best treatment plan that's been reviewed, is that if we look at a patient that's, from the time we saw them the last time, that they've had 3 bleeds. So we might say, okay, you've had these 3 bleeds. So if they've already have a pharmacokinetic profile using WAPS email, and if they're using the MyWapps, we'll look at, so when did they bleed? Did they bleed just before their next prophylaxis? Did they bleed the day after their prophylaxis? So that information is really, really helpful, that if someone is on an every 3-day schedule and they're having a bleed just before that infusion, then that will, trigger a conversation with your physician to see if there's some modifications in your treatment plan. And your physiotherapist will also have an in-depth conversation with you with regards to the types of physical activity that you're having. So if you're somebody that's playing golf, and you might want to have a conversation with them to see if you have any target joints. You're a golfer, but yet your elbow is something that you have a target joint with. So there will be a group discussion. I know here we have group discussions with the patient, the nurse, the physio, the doctor, and your doctor is your prescriber, but we all work together to make the best plan that best fits your needs. And of course, the most important thing is that it's good for you. There's things that we can say is good for you, but the bottom line is that it's all about you, and that you walk away feeling like that we've given you the optimal treatment plan that tailors to your daily activity.
Thank you. That's a very comprehensive answer. We've got another question here, starting with a statement. Thank you, Kay. I understand that any age can have a PK performed and use MyWapps. I'm interested in learning about how people are actually using it on a day-to-day basis.
So I guess I've given those few testimonials on how patients are using it, and then it's just an example that sometimes if a patient calls because they've had a bleed, they'll let us know what their MyWapps is actually showing, just like was showed in that sample. And on the video, the testimonial video as well, it was also showing that it's worry-free, feeling the freedom. So you got your child that's out on his bike and he comes in because he fell off his bike, then you have the ability to look and see where his level is, and to make that judgment call if you felt that he needed a treatment. But those are the things that we are still fine-tuning with regards to how patients are using it. And there's going to be more research, more publications, and it's going to be exciting to see more publications on how this information has helped optimize patients' care. So I think in the next few months, we're going to get more things published that will help guide patients a little better. There was a slide there that I talked about that was published looking at the different targets that you might need for different activities. So that was just one great paper that I found it very interesting to read, and I'm sure there will be many more publications that will help us as healthcare providers to be able to help better guide the patients in using their programs like MyWapps.
Thank you. I think we've got time for one more question here, and it's a pretty broad one. What features does the Watch app offer?
What features does the, sorry, say that again?
Does the Watch app offer, the one that you highlighted there?
In all honesty, I do know that you can use the MyWapps on your smartwatch. I do have a smartwatch. I have the WAPS there, but I never even tried it. So I do apologize. I probably should notice, but I'm thinking that you could probably go in and see at a much smaller screen pretty much everything that you see on the app on your phone. But I have not physically gone in and gone through it. But I do know that the smartphone can be used. So if it's something that I think you could probably use all the features that's there, but I didn't physically go in and test it, and maybe I should.
I'm getting a message from our tech support telling me that it actually mirrors all of the features of the app. So the phone app and the Watch app apparently are functional with both.
Okay, thank you. And I would have been able to have done that because I do have a smartwatch, but I did not.
For sure. I'm just going to check if we have any more questions here. No, that's it. I think we've managed to answer all the questions in the list with good time. We're at 6:04. So at this time, I'd like to thank you for this great presentation and all the time you put in to make it for us and our community. I'm really excited to have it edited and put up on the website so that we can show it to the community and so that we can refer them to it when they look for a way to personalize their care. And to thank as well Bayer, who funded our webinar today.
Thank you. Thank you.
Thank
Bye.
you so much.
Thank you.